So it's very important to have a doctor who will prescribe you narcotic pain medication but not treat you like shit or like you're a druggie, because that is a complete trigger for me. I actually went to see a spine doctor because we didn't know what was going on with my rotator cuff. I had something protruding in my back. Later on we learned it was my shoulder blade. But once he did everything, I explained about the NSAIDs and how I cannot take aspirin, Advil, Motrin, any of those things. I can only take Tylenol, which is not really a very good pain reliever. He didn't ask any questions. He said, I totally understand. So he called CVS. He called him into CVS. Well, CVS wouldn't refill my Xanax and said, it's too much. Okay. I don't know when pharmacies got their degree as a doctor, or where the DEA did. I don't know. Whatever. I do know that cancer patients, it is very hard for us to get any pain relief. We suffer a lot. I get a headache, I have nothing I can take for it. I get a migraine, nothing I can take for it. I pull my nails out, nothing I can take for it. And it's just absurd. The law needs to change on that. But what really pissed me off is when I did call CVS to pick up the refills that he called in for me, because he's my doctor. The girl that answered the phone said, we're not going to fill these for you. Okay, why not? I mean, I had no idea where I got them in the first place. But I have a pharmacy that delivers my targeted therapy medicine, because you can't just pick it up at any pharmacy. It has to be delivered. So they deliver it. And then I go to this other pharmacy because CVS refused to refill Xanax or something. I don't even remember what it was. They get very strict about that, the big corporation. So it's always good to get a little small pharmaceutical place that you can go to. So when I called CVS, the lady laughed at me and said, are you kidding me? You're lucky we filled your pain medication the first time. You're on so much medication. Okay, well, here's the thing. I got diagnosed with a terminal illness. So, shouldn't I be able to be pain-free? If I overdose, that's my fault. But I'm not going... I have overdosed before because they didn't give me pain medication. So, that's a whole nother story. And I learned my lesson. But anyways, you have to fight. And you have to find good pharmacies, good psychiatrists, good doctors. And it is so hard. But once you get there, once you get into it, and you've finally figured out your people, your team, things are so much easier. And I've only, I'm 12 years in, and I'm just now starting to want to live again. I mean, I had one foot in the grave and one foot on earth throughout the past 12 years. And finally, I told myself, if my scans come back okay, I'm going to start living again. I'm living. So, I am living. And along with that, though, comes some different things that you have to do in your life to make yourself happy.